reducing the premium increases that employers are seeing. I would ask for another 1 minute.
I yield the gentleman an additional 1 minute.
The gentleman is recognized for an additional 1 minute.
I thank the gentleman. So the employer rates, which have risen at the slowest rates in the last 5 or 6 years, would once again be subject to the kind of spikes that happen here. Look, I think there's bipartisan agreement in this chamber this morning that if someone has gotten a cancellation notice, we want to help that person keep their plan if they choose to keep it. We agree with that. The President agrees with that. That's what he set out to do. What we do not want, and what this bill does, is to guarantee rate shock, guarantee a premium spike for Americans, whether they're in these plans that we're talking about today, whether they're in the new marketplaces, or whether they receive insurance through their employer. We need additional protections where insurance commissioners around this country can step forward and investigate arbitrary and unfair practices, where they can protect consumers, and House Democrats are going to put forward such an opportunity to vote on that at the conclusion of this debate. Let's not, in the guise of solving one problem, magnify another one. We should oppose this rule and oppose the underlying bill. I yield back.
Gentleman from Texas.
Mr. Speaker, may I inquire as to how much time remains?
Gentleman from Texas has 13 minutes remaining. The gentleman from now Colorado has 4½ minutes remaining.
Let me yield myself 3 minutes.
Gentleman is recognized for 3 minutes.
For purposes of response, you know, the rate shock issue is one about which every member of this House should be concerned. Let me read to you from a letter that I received from a constituent who lives in the Colony, Texas, a city within my congressional district. They're complaining about the cost and the lack of transparency on the healthcare.gov website. I'm quoting here: the prices on the Obamacare website say what we can expect based on our ages is from $372 to $600. But when I go to actually purchase, those prices automatically become $870. We don't qualify for subsidies, so that was not part of any calculation. The constituent goes on to say it's bad enough that the President has lied to us on multiple points: $2,500 a year savings, keep your plan, keep your doctor, but also the website designed to mislead us about the price as well. What is the reason that the Obamacare site and health carrier sites don't agree? I just saw a North Carolina couple on the news who had the same experience, and the insurance carrier told them that the prices on the carrier sites are correct and those prices on healthcare.gov are incorrect. You know, there is rate shock going on in the country right now. That's what part of this debate is about today. But let me just caution my colleagues on the other side of the aisle that the true rate shock experience is likely to hit in September of 2014, about 6 weeks before Election Day in November 14. What is the reason for that rate shock? Well, we all know that the healthcare.gov website was so far an abysmal failure. The administration is counting on a certain demographic to flood to that website and sign up for their wonderful new Elysian fields of Obamacare. But it's hard, so they're not going to do it. But people who are older, perhaps have multiple chronic conditions, who are actually fearful about losing their health care coverage, they're going to keep at it. Bless their hearts, they'll keep going. They'll keep coming at day after day after day until they can finally get through and sign up for the insurance policy. Yeah, it's more expensive than I wanted, doesn't cover as much as I wanted, but by golly, I'll have something at the start of the year. The problem is the demographic that the administration counted on to sign up is not going to show up. Now, beginning about April of this next year, the insurance companies are going to begin to price risk. That's what they do. That's what they do well. So they are going to price risk, and they will post their prices somewhere along the line July 1st to September 30th. And those prices for the renewal of health insurance are going to be staggeringly high. They'll be astonishingly high. The rate shock that is fixing to happen, you ain't seen nothing yet. It's coming in the fall, and it will be unbelievable compared to anything you've seen to date. I'll reserve the balance of my time.
Gentleman's time is reserved. Members are reminded to refrain from engaging in personalities toward the President. The restriction includes quoting from extraneous materials. Without objection, the gentleman from Colorado now controls the time and is recognized.
I thank the Speaker, and I'd like to yield 1 minute to the gentlewoman from California, the Democratic leader, Ms. Pelosi.
Gentlelady from California is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the gentleman for yielding. I thank him for his leadership and that of the whole Rules Committee on having to field some really strange notions masquerading as proposals to improve the lives of the American people. And we see a lot of that these days. But this one on the floor today really takes the cake because it is essentially pull the plug on the Affordable Care Act. And while it says that they want to delay the cancellations that the insurance companies have written to policyholders, the bill does not mandate. So this is a conversation. It's not an action, but it does violence to the bill in other ways. That idea that it was helping consumers was sort of the Trojan horse whose underbelly is poisonous in terms of the health and well-being of the American people. Mr. Speaker, I rise to come to the floor on the rule because I think it's really important for members to vote against the rule as a point of fairness. If we reject this rule and allow the Rules Committee to come back to the floor with an opportunity for there to be a Democratic alternative, that would be fair. And what we would do in the vote on the previous question, which I urge people to vote no on, would be able to vote yes or consider voting yes on a bill that does exactly what consumers need in terms of this cancellation area. First of all, it would say that there would be a real delay for 1 year for the implementation in terms of the individual policy holders. That's just this piece of the bill that is the question, individual policy. 95% of the American people, as has been said, who have policies that they like can keep them. It's this 5%, and that's a lot of people. I don't want to minimize that, but nonetheless, it's a discrete market. So let's address that discrete market, and in our previous question, we bring up a bill that addresses that discrete market, not only by enabling them to hold their policies for a year, but by requiring that the insurance companies must tell people, not that you're canceled, but these, and we want to sign you up again at a higher cost. Instead, insurance companies would be obliged to tell people what their options are. What their options are under the Affordable Care Act in terms of having no lifetime limits on their policies, no annual limits on their policies, no pre-existing condition increasing the cost of their policy, or preventing them from holding their policy should they become sick. A. B, it would also make sure that the insurance companies tell people what their options are in the exchanges, or that they may qualify for a subsidy, that they may in that marketplace. The insurance companies are competing. This is a free market, this exchange. They are competing for their policy, and therefore that has already lowered cost to consumers. So they may have a better policy with better benefits at a lower cost, and if they qualify, get a subsidy to do it. In addition to that, it's really important in every respect that in everything we do, not only just for this individual marketplace, for people to understand the benefits of the Affordable Care Act that are available to them. I mentioned no pre-existing condition, no annual limits, no lifetime limits, but also that already for the past over 1 year, young people can be on their parents. Over 3 million people have benefited in that regard. Tens of millions of seniors have benefited from the free prevention checkup, mammograms, whatever kinds of things, prevention and wellness exams, free, no copay, no deductible. Already seniors are experiencing lowering costs for their prescription drugs because of the Affordable Care Act. Already small children cannot be discriminated against, nor their families, in seeking insurance because they have a pre-existing condition. Imagine a child born with a defect, and I think for life. They have a pre-existing condition which will cost them dearly in terms of premiums if they can even get insurance, and then it would be with limits. Not so. That's all changed. That's why on this Upton bill, which, as I said, is it not only does bad things to the Affordable Care Act in terms of disrupting the risk pools, it tries to masquerade as something that does something positive, which it does not. And that is why the Upton bill is opposed by a broad coalition of groups: the American Heart Association, the American Diabetes Association, the American Cancer Society Action Network, National Partnership for Women and Families, Paralyzed Veterans of America. Anyone with a pre-existing medical, 100 million people are in families with people with pre-existing medical conditions. All of them benefit. The stories are so glorious and so beautiful about what a difference the Affordable Care Act has made to families, especially those with small children or those with pre-existing conditions, and to seniors. And again, being a woman is no longer a pre-existing medical condition. So this is politics. It's not about policy. It isn't any attempt to improve the Affordable Care Act. One way to improve it, though, is what we have in our previous question. Give the state commissioners, state insurance commissioners, the authority, all of them. Some of them have it, but ensure that all of them have the authority to investigate and act upon rate increases, as well as the nature of these letters that were sent out without the integrity that they should have had. Again, we require that they also, in these letters, that the insurance companies make sure that people know what their opportunities are. So what we are proposing today really does make a difference. In fact, we wanted to get this requirement of the insurance commissioners into the underlying bill. And then we said, okay, we'll do that as an improvement. Today is a day that we can do that by voting no on this rule and enabling us to bring a bill to the floor that would do that. With that, Mr. Speaker, I urge our colleagues to support the Affordable Care Act, support what it does for America's families, stand with those who fought for Social Security, for Medicare, affordable care for all Americans, because these are three pillars of equal weight in terms of the economic and health security of the American people. They honor the vows of our founders for life, a healthier life, liberty, the liberty to pursue your happiness so that you're not job-locked or constrained by a policy, but free to follow your passion, to be self-employed, to start a business, to change jobs, to be entrepreneurial. Life, liberty, pursuit of happiness. Vote no on the rule. With that, I yield back the balance of my time.
Gentleman from Texas.
Mr. Speaker, I'll yield myself 3 minutes.
Gentleman is recognized.
Mr. Speaker, I want to remind members of the House of Representatives about the President's press conference yesterday. I'd like to read from the transcript of his remarks. Quoting from the President yesterday, he first talked about the problems with healthcare.gov website, big problems, and maybe we can talk about those a little bit. But then he went on to say, quoting here, "The other problem that has received a lot of attention concerns Americans who've received letters from their insurers that they may be losing the plans they bought in the old individual market, often because they no longer meet the law's requirements." Seems pretty straightforward to me what the President was saying yesterday. He goes on to say, further quoting, "Now, as I indicated earlier, I completely get how upsetting this can be for a lot of Americans, particularly after assurances that they heard from me that if they had a plan that they liked, they could keep it. And to those Americans, I hear you loud and clear. I said that I would do everything that we can to fix this problem, and today I'm offering an idea that will help do it. Already we have plans that predate the Affordable Care Act, and people can keep those plans if they haven't changed. That was already the law. That's what's called the grandfather clause that was included in the law. Today, we're going to extend that principle both to the people whose plans have changed since the law took effect and to people who bought plans since the law took effect. Ending the quotation there. You know, it's interesting, the 10th Amendment of the Constitution should actually protect the states to issue their own directives through their state insurance commissioners. They didn't need the President of the United States to do that. That is power that's been enshrined to them in the Constitution. The problem is that that power was taken away under the Affordable Care Act. Now they've attempted to bring it back, but the fact of the matter is, in many states, patients and constituents won't have that protection. But the Upton bill today will actually provide that protection. Make no mistake, the Upton bill is not a fix-it bill for the Affordable Care Act. It is a lifeline that we're extending to our constituents who have lost the coverage that they were told that they could keep. I'll reserve the balance of my time.
Gentleman's reserved his time. Gentleman from Colorado.
Yield him to the gentleman from Pennsylvania, Mr. Fattah.
Gentleman from Pennsylvania is recognized. May I inquire as to how much time the gentleman plans to yield?
It was 1 minute.
1 minute. Gentleman is recognized.
We only have a minute, 60 seconds in it. So let me be concise. On Monday, I was in San Diego with 30,000 brain researchers excited about the age of discovery and attacking diseases like Alzheimer's and bipolar and schizophrenia. On yesterday, via satellite, I spoke to a public health conference in Brussels for the European Union. Their theme was that the wealth of their member countries was the health of their populations. And then I come to the floor today where we see people who want to retreat from the ideal, which is to make sure that every single person in our country, for the first time in this nation's history, has access to affordable health care coverage. There will be no retreat, no equivocation. I know there's this desire among members on the other team always to somehow to go backwards, you know, to some other age in our country, as if our future is in the past. Our future and the shaping impulse of our country is in the future, and it's in the health of the citizens of our country. I thank the gentleman for yielding me 60 seconds.
Gentleman's time has expired. Gentleman from Texas.
At this point, I would like to yield 5 minutes to the gentlelady from Tennessee, Vice Chair of the full committee, Marsha Blackburn.
Gentlelady from Tennessee is recognized for 5 minutes.
Thank you, Mr. Chairman. I am pleased today to stand in support of the rule that will allow us to bring the Keep Your Health Plan Act to the floor. It is important that we take this action today on H.R. 3350 because we have heard from the American people from coast to coast, that they do not want the President's health care law. They do not like the President's health care law. They feel as if, and have realized, that what is happening with this law is that, number one, it is restricting their choice and options when it comes to health insurance. And number two, the cost is skyrocketing. Now, we know that that is very important to our families who have chosen health plans that meet their needs, health savings accounts that allow them to take individual responsibility for their health care, allow them the opportunities for choosing doctors and physicians and keeping those doctors and physicians. And what the American people are telling us and our constituents are telling us is that they do indeed feel betrayed by the empty promises that the President and this administration have made. They're also quite concerned about the botched website rollout, as I said, the insurance premiums, and those cancellation notices that are hitting the mailboxes of millions of Americans. And they say, you know, this is not what we bargained for. It's not what we were promised. It's not what we voted or spoke in favor of. And so they're asking us to take an action. And H.R. 3350 does take that action. Now, Mr. Chairman, I want to go back to 2010 when we had a conference and the President was before us, and I asked him a question about the ability to keep plans and individuals to stay insured. I spoke because of the experience we had had in my state of Tennessee with the test case for Hillary Care, which was called TennCare. We saw the effects of that. We knew it was the test case for public option health care. We knew it was too expensive to afford, and overall we knew it did not work. In his response, the President mentioned a little bit about some stray cats and dogs, and that he thought they had that cleaned up. But I have to tell you, our constituents and their policies are not stray cats and dogs, and they deserve to have the opportunity to keep their health care and not to be treated in a disrespectful manner or to be discarded to the sidelines. So the President needs to realize he cannot go around waving a magic wand and fixing this by executive fiat. This is a law. We are a nation of laws, and we abide by the rule of law. Obamacare, the President's health care law, is the law of the land. In order to provide relief to the American people who have clearly spoken to say they do not want this law, it requires an action of Congress. Today's action will provide relief for some individuals, not as many as we would like, but it is one step in providing some relief. The American people have grown weary of this administration spending money that it does not have on programs the American people do not want. And the President's health care law is a great example of a program that the American people do not want. So they have come to us as the people's representative and said and reminded us that we are a government of, by, and for the people, that should be working for the people. And as one of my constituents told me Monday, we the people are going to start being the people and holding this administration and this Congress accountable. Today is one of those steps that we are taking on behalf of our constituents and the people of this great nation. I thank the gentleman from Texas for the exceptional work that he has done in working with Chairman Upton from Michigan on bringing this to the floor, and I yield back the balance of my time.
Gentleman from Colorado.
Thank you, Mr. Speaker. I yield 1 minute to the gentleman from California, the chair of the Democratic Caucus, Mr. Becerra.
Gentleman from California is recognized for 1 minute.
I thank the gentleman for yielding. In the past month, 500,000 Americans have secured affordable health insurance. They are people that include folks in my state of California like Erin Katecki Vest, who said the old plan she had all sorts of deductibles and out-of-pocket costs. At the end of the day, what did she say after going on Covered California's marketplace exchange? She'll be saving $18,900 per year by having shopped on the exchange under the Affordable Care Act. Paulo Daoud said he passed on an employer-based insurance policy that would have cost him $504 a month. He got on Covered California's website. He picked Kaiser. He now qualifies for a plan that charges $176 a month. Alan Pasella says, my wife would not have insurance coverage at all as of January 1st. They shopped on the website. They are now saving $8,000 a year for, as he said, a very much better plan. And Andrew Stryker from Los Angeles, California, 34 years old, lives in, as I said, in my city of Los Angeles, had to wait 3 hours to enroll. $6,000 savings. Let's improve this plan. Let's not destroy it. It's time to move forward and give Americans what they need, health security. I yield back the balance of my time.
Gentleman from Texas.
Reserved time.
Gentleman reserved. Gentleman from Colorado.
Inquire if the gentleman has any remaining speakers.
Well, I'm always here, so I remain as a speaker, but it will just be me.
You're prepared to close?
Absolutely.
I yield myself the balance of my time.
Gentleman is recognized for the remaining time, which is 90 seconds.
Mr. Speaker, if we defeat the previous question, I will offer an amendment to the rule that will allow the House to vote on a substitute that allows Americans to keep their insurance if they like it. Mr. Speaker, I ask unanimous consent to insert the text of the amendment in the record along with the extraneous material immediately prior to the vote on the previous question. Mr. Speaker, there's a number of ways that we can improve upon the Affordable Care Act. One of the ones that I'd like to highlight that we could be bringing here to the floor today that the Senate already passed is comprehensive immigration reform. H.R. 15 here in the House, a bipartisan bill that I'm confident would pass if brought to the floor, would finally make a dent in the fact that there are more than 10 million people here in this country illegally, the vast majority of whom don't have any access to health care insurance. So American citizens are essentially being forced to pay for the health care costs of people who are here illegally every day until we pass comprehensive immigration reform. We're wondering why rates are going up. It's no surprise, Mr. Speaker. When somebody doesn't have insurance, their costs are shifted onto other people who do. Now, yes, there's Americans who don't have insurance, and the Affordable Care Act helps increase the access that many Americans have to insurance, but it doesn't do a thing about the fact that there's more than 10 million people here illegally in this country in violation of our laws who do not have health care insurance. If we can pass H.R. 15, Mr. Speaker, people who are here illegally will have to get insurance on their own instead of forcing Americans to pay for their insurance. I urge my colleagues to vote no on this rule, defeat the previous question, and I yield back the balance of my time.
I thank the Speaker for the recognition. You know, I just can't help but think back to that September evening in 2009 when the President stood before a joint session of Congress after the August recess and made a statement to the nation that, yeah, he was trying to change health care, but not to worry, that no one who was in the country without the benefit of a Social Security number would be included in that cost, because many people are concerned that the cost for the Affordable Care Act, already high, would expand unreasonably if that were to change, and the President made a promise to the American people that night. Well, Mr. Speaker, we've heard a lot of stuff today. I really wish there had been that much interest in improving the Affordable Care Act before it passed the first time. We all know the reasons why those improvements were not offered and why we just simply had to have a take-it-or-leave-it proposition that was ultimately signed into law. But, Mr. Speaker, today's rule provides for the consideration of a critical bill to protect the millions of Americans who are facing the loss of health insurance that they were promised that they could keep. So I certainly thank my friend from Michigan, the Chairman of the Energy and Commerce Committee, Mr. Upton, for producing this thoughtful piece of legislation. At this time, I would like to yield back the balance of my time, move the previous question on the resolution, and ask for its approval by the body.
The gentleman yields back his time. All time for debate has expired. The question is on ordering the previous question on the resolution. Those in favor will say aye. Those opposed, no. Opinion of the Chair, the ayes have it.
Mr. Speaker,
from Colorado.
On that I request the yeas and the nays.
Yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. Sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. Pursuant to Clause 9 of Rule 20, the Chair will reduce to 5 minutes the minimum time for any electronic vote on the question of adoption. This is a 15-minute vote.
So a procedural vote here as they work on the rule on this bill. We're going to take your calls in just a minute. You see the numbers right there on your screen. If you're listening on the radio, I'll give you the phone numbers right now. 202-585-3885 if you're a Democrat. Republicans call C-SPAN here at 202-585-3886. And independents give us a call at 202-585-3887. I'd like to see your reaction to what's going on here in Congress today. A couple of tweets to read for you, and you can tweet us anytime you like, hashtag C-SPAN chat. Kim says, Dems argue against Keep Your Plan Act, saying it's Republican trick. Are you kidding? I suggest GOP pull the bill and let him hang. And Michael writes, or tweets, I should say, did Representative Upton write this bill, or did Representative Upton's largest campaign contributor, Blue Cross Blue Shield, write the bill? So lots of people getting in on the Twitter, saying what they think about this going on. Let's see what we see on Facebook as well, another way for you to contact us here at C-SPAN. This is from Will Political Hack. That's his handle. There's no free lunch, only taking money from someone else. Looks like everyone is learning that rule. So this, a procedural vote on the rule, then we think about an hour of debate. That's what the rule calls for. And then a vote on final passage of this bill somewhere maybe around 12:30 this afternoon. Of course, we're going to have all that for you right here on C-SPAN. Also, the White House putting out a statement earlier saying that should this bill as it's written be presented to the President, he will veto it. Some of the background on the bill, this bill introduced by Michigan Republican Representative Upton, who is the chairman of the, which committee, he's on the Energy and Commerce Committee. So that is the situation we're in. Now let's get started with some of your phone calls here. We're just going to go ahead and say hi. You're on C-SPAN. Hello there.
Hello?
Yeah, hi.
Yeah, good morning. I'm actually pretty much opposed to anything that the Republicans doing because I feel like they doing things to try to undermine the stability of the law. I know it's a shaky deal at the moment, but it is a new and a very large program, and I feel like Americans should give this a try. People do deserve insurance. They shouldn't have to go bankrupt when they need their insurance. It should be there. Insurance companies should not be able to get away with ripping people off and pocketing their money. And I feel like it's time for us to back President Obama and let him do the legislation like it needs to be done. And that's all I have to say.
All right, appreciate the call. Let's go to John in Texas. Hi, you're live. What do you think?
Well, I don't agree with what the man said. Not at all. You know, I do believe that we need to, take care of our people, our sick people. I understand that, but when you start dictating to the people of this country that what doctors that they can have, what hospitals that they can go to, and those type of things that's my choice. I'm 81 years old, and I've never seen this country in such a condition that we're in at this time. Now, he can support his president. I don't. And I'm a Republican, and I'm very proud of it. And conservative at that. And I think that we need to make our own choices, not the government telling us what is best for us.
All right, appreciate the call. We're going to move on. Let's go over to Illinois. We have Rex on our line for Independence. What do you think? Go ahead. You there?
Yeah, I'm here.
You're on the air. What do you think?
Well, I think they just need to quit messing around and just pass the damn thing. And I've been in and out of the hospital with seizures and 2 strokes. And I just can't afford the medication.
So what would you like to see happen here today in Congress?
Just pass the damn health care bill.
All right, thanks for your call. Let's go over to Virginia. Lou on our line for Democrats. You've been watching some of this. What do you think?
Yeah, what I'm really concerned about is the damage, the potential damage it's going to do to the Democrats. It's been reported about, Mr. Obama, President Obama lying, but there's 2 other lies that the Democrats have been saying also. One is about that Medicaid is going to be, the Medicaid expansion at the state level is going to be covered 100% by the federal government. That's just not true, and I'm afraid once that comes out, they're not going to, that'll be another exposed lie. And then the second one is the promise Mr. Obama made to the individual market. Next year in 2014, the same thing is going to happen to the private business insurance marketplace. The ones that aren't covered by ERISA will have to go to the marketplace, and the cost will be greatly expanded there, and some 93 million people will lose coverage. So I'm very concerned about it.
All right, we appreciate your call. We're taking calls here on C-SPAN this morning. Your reaction to this bill here before Congress. This is a procedural vote right now, and a vote a little bit later on. Again, we don't know what the Senate's going to do, and we certainly do know that the White House has said this bill sponsored by Representative Upton, should it reach Mr. Obama's desk, would receive a veto. Again, our numbers, if you're listening on radio, Democrats 202-585-3885, Republicans 202-585-3886, and Independents give us a call, 585-3887. Let's go to West Virginia on our line for Republicans. All right, so what do you think about what's going on with the Health Care Act?
I think it's very sad. When it comes down to it, if you can't afford it, it doesn't matter how wonderful it is. You can't afford it. I'm a full-time nursing student. My husband works his butt off. We have no insurance. We would if we could, but we cannot. Yet we will be penalized even more. The bill has many flaws, but yet we are being mandated to jump on board with it.
And what kind of health care do you have now, ma'am?
I have nothing. I would love insurance. I would absolutely love insurance. But if you cannot afford it, you cannot afford it. At this point, I'm almost ready to graduate with my BSN. I will be forced to quit and work so that we can pay for insurance now rather than stay in school, have a good job, and be able to pay for insurance on my own. Choose my insurance, not be told what I need.
All right, appreciate the call. I'm sorry, we're going to move along here. Let's read a couple of more of your tweets for you. We have a doctor who tweets in and says, watching this from the AMA meeting, that's the American Medical Association, we continue to put politics above patients, ? Let's improve the law. And Marsha Blackburn, here's one from No More Tea Thugs. That's the handle the person uses. Marsha Blackburn has got to have the most uninformed constituents if they believe she works for them and not for someone else. Again, your comments welcome both on Facebook and Twitter. Let's move along here. We'll go over to a line from Georgia. Is it Jen?
Joe.
Joe. Hi, Joe.
Hi, how are you today?
Good. You're on C-SPAN. What do you think?
Thank you for taking my call. I just want to talk about this whole health insurance thing. This is nothing but corporate welfare for the insurance companies. The insurance companies serve as a middleman between the people and the medical industry, and we pay them money. They take out billions of dollars to cover all their expenses, and what's left goes to the insurance companies. I'll bet every single congressman and the president have received money from the insurance company, whether they're Democrats or Republicans, so they should all recuse themselves and not even vote on this bill.
Well, Joe, did you see the president yesterday? And if you did, or if you read what he had to say, what do you think about his position now?
Oh, I saw what he said. I studied every word, and I think he's part of the problem because he more or less has to do what he's told by the insurance companies, by his advisors. I know he didn't read the whole bill. I doubt if there's anybody that read the whole bill. But he's got people that were supposed to read it, and if they misinformed him, he should have fired them. But they're not interested in doing the right thing. They're interested in protecting that money that they're getting in from the insurance industry because it's massive. And there's no way that the American people can afford to keep on sending money to these people who are stealing it from them out in the open, blatantly, and calling it health care or whatever you want to call it. It's unbelievable to me that the people can't see this. It's like a big Ponzi scheme, and they're getting away with it.
All right. Thanks a lot, Joe. We appreciate the call. Let's move on to our line for Democrats from Florida. Hi. Go ahead. You're on C-SPAN. Hi there. Hi. Go ahead.
Yeah, my name is Eloisa Lopez, and I'm an American, for 47 years. The Obamacare doesn't work. They should repeal this law, and the president should resign. All the trillions of dollars wasted on this, project, everybody should have insurance by now with all the money they spend, and we, the taxpayers, have to pay.
All right, appreciate the call. We'll go to Mississippi. Cindy's on our line for Republicans. Hi, you're on C-SPAN. Good morning.
Good morning.
Go ahead.
Yes, sir. I don't think that this is this Affordable Care Act is affordable at all. I checked for a family member who barely makes about minimum wage, is not covered by insurance at their job, and when I went to look at how much it might cost them to get health care, it's going to cost them over $10,000 to $12,000 a year. I'm sorry, which they tell me is 80% of their income. How is that affordable to a family who's struggling already at 80% of their income, they wouldn't even be able to pay rent.
All right, let's go to Ohio, our line for independence. Ken, hi, you're on C-SPAN. What do you think?
Well, I think this is what you get when you have one party. You got to remember now that the Democrats took over the House and the Senate in 2006 election. So they were in power for a long time. And when you have big government Democrats passing control over 1/6 of the American economy with no bipartisan support whatsoever on a Christmas Eve, what do you expect to get other than a fiasco?
All right, appreciate that call. Let's take another look at our Twitter feed here. Independent Dan writes in at hashtag C-SPAN chat, Obama's arrogance can't outrun the truth, period. Wish he could bend the cost curve as much as he bends the truth. Let's go to North Carolina on our line for Democrats. Hi there, you're on C-SPAN. You've been listening to some of the other callers. What do you think this morning? North Carolina, go ahead.
You're talking to me, huh?
Yep.
Oh, I've been listening. All right. I think it's kind of funny. I think if we live in a country with as many people and as many rich people as in it, you know, to me, the Republicans could care less about poor people. The sooner they get rid of them, the better. Maybe this won't work, but something sooner or later has to work. We, the people, are not the rich people in this country. We, the poor people, are the people in this country. We need to get back to our roots and not the thugs in what's in Congress now. Because I used to call them Republicans, but they're nothing but thugs.
All right, appreciate that call. Let's go to Texas, our line for Republicans. Hi, go ahead. You're on C-SPAN. Texas,
Hello.
Hi there.
Hi. Yeah, I'd just like to know why more questions aren't presented to these representatives about, if this is so great, why isn't the government opting out of their insurance plan and getting into the Obamacare plan? I think that's a question each one of them need to answer.
All right, as I recall, that was one of the suggestions brought to the floor of the House some weeks ago, and didn't go too far. Thanks for that call. Let's go over to North Carolina. I think it is our line for, it's Michael, our line for independence. Hi there, you're on C-SPAN, Michael.
How you doing?
Good. What's on your mind?
All right. I just found out even if this bill passes, Obama has threatened to veto it, and yet he gets out there yesterday and says he wants to help the folks who have lost you know, their insurance. I'm absolutely dumbfounded by the things he's done, and yet he continues to get away with it. I don't know why nobody's bothering to impeach him. I think he should have been impeached. And everybody
For which particular, what would you impeach the president for?
Well, for one, he's went around Congress several times. This law here, he lied. Everybody knows he knows everything that happens. He says, I don't know. I don't know. Every president knows what goes on in his administration. I have notified my senator in North Carolina about articles of impeachment because this guy continues to get away with all this stuff. And it's just very upsetting. And now he's threatening everything the Republicans try to do. Oh, I'll veto it. Yet he'll get up and say, well, I want to help everybody. I'll work with the Republicans. And when they put a bill out, well, I'll veto it. So it's
all right.
Just a big mess.
We got your point. Let's move along here. Let's go over to Oklahoma. Hi there. You're on C-SPAN.
Hello?
Yeah, hi. You there?
Yes. I just wanted to say I've been a Democrat for 48 years. And I was raised probably more independent than a lot of these folks. But I don't believe the government is responsible for health insurance for anybody in this country. That's up to the individuals.
Well, what do you say about folks that don't have any insurance? Maybe they have small kids. How should they take care of their family? What would be your solution?
Don't we have people taking care of them anyway?
Well, who would pay for that? That's the question I'm asking you then. How would that get paid for?
Well, the government's got Title 19.
Which is?
Well, it takes care of the people that don't have the money.
Okay. All right, let's move along. Let's go on over to Florida. Hi there. You're on C-SPAN.
They're not prepared to pay for.
Hang on one second here.
Sure.
Florida, you there? Hello, Florida.
No, this is Pennsylvania.
All right. Well, Pennsylvania, go ahead.
Okay.
I pressed the wrong button. We'll talk to Pennsylvania.
That's okay.
Go ahead.
Hey, what I got to say is the people in this country, and I agree with the other man, we are responsible for our own insurance, okay, and I know the needy always need help, but this government has done away with the jobs in this country which were provided health care for the people. We want to act like we need to give them everything instead of making them work for everything. There's a big difference here, but thank the guy in the White House for that. And not only that, he is a president. He is not a dictator that says, well, guess what, you can change this, that. This man needs impeached. He needs to go away. We have a total screwed up country thanks to the man that sits in the White House right now. And I don't want to hear people say racist this and that. That's not the issue. It's he's making stupid choices because he wants to be a socialistic country and give everybody everything for free. And that is not what America stands for. We work, and we earn. And that's how we prosper in this country. And everybody has a right to make money and make a profit if you're in business. Or why would they be in business?
All right, thanks for your call. That's Pennsylvania. Let's go now over to Mississippi. Hi there.
Hello.
Hi, you're on C-SPAN. Go ahead.
Yes, sir. I just want to say that everybody keeps saying these different things about impeaching our president when he hasn't done anything to be impeached. If you're going to impeach someone, impeach all these Tea Party Republicans that are trying to block everything that the president is doing to help the poor, to help people who can't do for themselves, the disabled veterans that people tend to even throw away when they're done serving this country.
All right, appreciate that call. Tell you what, we'll take a look back here. We see the vote is still going on. The times are out, but you can see about 157 votes yet to remain. This is a procedural vote on the rule for this bill, then we expect an hour of debate and then a vote on final passage. Again, the White House saying even if this bill, as it stands, is written or sponsored by Representative Upton, should get to the president's desk, he would veto it. Let's go over to Brenda in Florida on our line for Republicans. Hi.
Hi, my name is Brenda. I just wanted to say I'm so thankful for the Republican leaders that are on the floor today that are representing we the people. They are doing what we are asking them to do. And for Obama to veto it, it should be an impeachment should be started against this man because he is running against we the people. When people call and say, their policy used to be 200 and now it's going to be 500, and their minimum amount due over the year used to be 2,300 and it's going to be 5,500. People need to be scared because you know who's going to have a problem paying that? The black folks that want freebies.
All right, thanks for your call. Let's take another look at our Twitter feed at hashtag C-SPAN chat. We've got Maria who tweets, I guess lying to the American is, she's talking about one of our callers, says, I guess lying to the American people is no big deal to this caller. And then Ron tweets in to say, federal prosecutor says Obama is guilty of serial in-your-face crude fraud on multiple levels. Not entirely sure what Ron is referring to. Let's go back to our calls. We'll go over to Joel in Tennessee. Hi, Joel.
Good morning. I just want to say I was watching the House Speaker's House talking a while ago. A Democrat said that we had 10 million illegals in the country, and we have a whole heck of a lot more than that. And he was saying that they're getting free medical care, and we need to pass this immigration law. Well, 90% of the illegal immigration people don't have a high school education, which means they're going to be low income. So the people who pay the taxes are going to have to pay for their insurance regardless, whether they get it free from the hospital. Somebody's going to have to pay for it. I just wanted to make that comment.
All right, let's go over to Ricky in Louisiana on our line for Democrats. Looks like we got time for a couple more calls here. Go ahead, Ricky.
Yeah, I'm calling. I'm a Democrat from Louisiana, and I think that Obama is doing so much damage to this country with the health care law that we're stopping all pipelines, stopping all the jobs, He's not doing a good job, and I voted for him, but I ain't voting for him again. No Democrats.
All right, appreciate that call. Texas on the line. Philip, you're calling on our line for Republicans. Have you been following this this bill or this debate on the floor of the House this morning? What do you think?
Yes, sir. I've been following the bill, and you know, it's appalling to me to hear how many people in this country are really not thinking about small children and elderly. Those people can't go out and work for themselves. They've done their work already. And if they're in a position where they need health care or they need prescription drugs, you know, our country should be able to do something about that. And rather than trying to tear this law down, I think that more people need to stand up for it and start fixing it instead of trying to tear it apart. You know, all those people speaking about President Obama, and they need to be speaking about Congress not doing their job properly and not working together as Republicans and Democrats and independents. That's pretty much all I have to say.
All right, thanks
Educate
for the
yourself,
call.
people.
Go ahead. Thanks for the call there. And John from Wisconsin, you're on with the air here at C-SPAN. What do you think?
Hi, thanks for having me.
Sure.
You know, I'm really, you know, these talking points that everybody has on your station is crazy. But, you know, I'm a business owner. I had to end up canceling all my insurance for my employees back in '06 because it was too expensive. I just went on healthcare.gov and checked out insurance, and boy, it is just really cost-effective. Website's working great. I can compare all the plans. My rates are going down to $200 a month from $700 a month. So, I mean, people really need to start looking at this. They need to spend a little time online and look into the plans.
And you're saying the website worked all right for you?
It worked perfectly.
All
Just
right.
went through everything. Signed up, checked out the plans. I got, what, 67 plans here I can look at? So, I mean, there's a lot of choices. And these are all health insurance companies. These aren't government-run facilities. These are Blue Cross Blue Shield. I mean, it's big insurance companies out there.
All right, appreciate the call. We're going to go over to Mary. Hi, Mary. You're on C-SPAN on our line for Democrats.
Hi. I have two sons that had letters from their employer saying their insurance was going to have to be canceled. Both of them went online and got another policy. Their policy was less than what they were paying for the junk policy that they had, and they don't have the $5,000 deductibles that they had on the first one. The only problem I have is with the governors being allowed to opt out. I think they should be required to cover them like everybody else.
All right. Thank you, Mary. Appreciate the call. We can see we're just about done with this vote. Then we expect about an hour of debate on the bill, and then the vote to follow that somewhere between 12:30, we're going to guess. And, of course, when that happens, we'll take some more of your phone calls. In the meantime, let's see if we can get a couple more of you on here. John from Florida, our line for Republicans. Hi there. You're on C-SPAN.
Hey, great. Thank you. My wife and I, we're both 31 years old, and we're medium class, you know, family. We have 2 daughters, and our health insurance has been about $900 a month. You know, we feel as though that's a bit pricey, but we have insurance for our family. About a week ago, we received a letter from Blue Cross Blue Shield, and our insurance has gone from $900 a month to $2,100 and some change a month. You know, we both, with combined incomes, make a little over $100,000 a year. But I think, you know, this Obamacare, I think, is really targeting medium-class families. We can't afford this. I mean, $2,000 a year, I mean, that's close to $25,000 a year. And I do think Obama, there are some grounds for Obama to be impeached. He just seems to be extremely incompetent on every issue, whether it's Benghazi, the IRS scandal, and you know, it just seems like there's a big lack of governing.
All right, tell you what, we're going to try and get another call in here. Thanks for your call. We do have one more vote in this series right after this. This is a vote, a procedural vote. Then there's a vote on the rule itself, and then we'll get right to the debate. But let's see if we can get in and talk to one more caller. Hi there, you're on C-SPAN. Go ahead. Hello.
Hello, this is Jesse.
Hi, Jesse. Where are you calling from? Michigan, is that right?
Yes. I'd just like to say I don't agree with either parties. I think they're both botching everything here. I think if we'd all move towards a healthcare system where profit is not the motivator, that the actual benefit to the people having better health be the motivator, then we would get a lot better health care. Corporate profit should not be the motivator here. It's wrong in any sense of the word for someone to deny someone else of having their health care taken care of because they don't have the money to pay for it. I mean, where's the humanity and the morals here is my question, to not just here in the United States, but globally. I mean, we're all human beings hanging on a rock floating in space. And the sooner we realize this, the better we'll all get along.
All right, thank you, Jason. We're going to get one more call in this go-around in Alameda, North Carolina. Our line for Democrats. You're going to get the last word this time. Go ahead.
Hello.
Hi.
Thanks for taking my call. I think what the Republicans are doing today is just a waste of time. I think they should work with the Democrats and try to make the health care law much better instead of wasting taxpayers' money. And that's my comment today.
All right, we appreciate that call. Thank you for all of you that called in. Again, there's a short 5-minute vote or so right after this, and then an hour of debate, at which point when the vote on this bill happens, we're going to open up the phone lines again. So if you have something to say and didn't get in, be a little patient, and we'll give you another chance in about an hour. And again, you can always comment anytime you like on our Facebook page and or via Twitter. I'd like to hear what you have to say. Let's take you back to the floor now as they wrap up this vote.
3, the previous question is ordered. The question is on adoption of the resolution. Those in favor say aye. Those opposed, no. Opinion of the chair, the ayes have it. Gentleman from Florida.
Mr. Speaker, I ask for a recorded vote.
Recorded vote is requested. Those favoring a recorded vote will rise. Sufficient number having risen, a recorded vote is ordered. Members will record their votes by electronic devices as a 5-minute vote.
Party line votes. If it is approved, then the general debate for an hour would start next. Live coverage continuing here, as always, on C-SPAN.
228, the nays are 189. The resolution is adopted. Without objection, a motion to reconsider is laid on the table. House will come to order. House will come to order. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker.
House will come to order. Gentleman from Michigan is recognized.
Mr. Speaker, pursuant to the provisions